Ethics in Surgical Practice, a comprehensive overview. Ethics in surgical practice is a critical component of modern healthcare, guiding surgeons in delivering care that respects patient autonomy, promotes beneficence, avoids harm, and ensures justice. Ethical considerations are particularly significant in surgery due to the invasive nature of the interventions, the potential risks involved, and the vulnerability of patients. Below is a detailed exploration of the key ethical principles, challenges, and practical considerations in surgical practice. 1. Foundational ethical principles. A. Autonomy. Patients have the right to make informed decisions about their care. This requires surgeons to provide comprehensive information about the nature, risks, benefits, and alternatives of surgical procedures. Respecting autonomy includes obtaining valid informed consent, ensuring the patient understands the implications of the surgery, and respecting their choices even if they decline treatment. B. Beneficence. Surgeons are obligated to act in the best interest of their patients by recommending interventions that are likely to benefit them. This includes balancing short-term risks with long-term outcomes, aiming to improve the patient's quality of life. C. Non-maleficence. First, do no harm is a central tenet of medical ethics. Surgeons must minimize risks and avoid unnecessary procedures that may harm patients. Ethical practice involves careful preoperative assessment, surgical precision, and postoperative care to prevent complications. D. Justice. Surgical care should be provided equitably, ensuring fair access to procedures regardless of a patient's socioeconomic status, gender, ethnicity, or other factors. Surgeons should also consider resource allocation and avoid unnecessary or overly expensive interventions that could burden the healthcare system. 2. Informed consent. Informed consent is a cornerstone of ethical surgical practice. It involves transparency, explaining the procedure, potential complications, success rates, and alternatives. Comprehension, ensuring that the patient understands the information provided. Voluntariness, allowing the patient to make decisions without coercion or undue influence. Capacity, assessing whether the patient has the mental capacity to make informed decisions. Special challenges arise with emergencies. When immediate intervention is required to save a life, informed consent may need to be expedited or obtained from family members. Minors. Consent must involve parents or guardians, with consideration of the minor's assent in appropriate cases. 3. Ethical challenges in surgical practice. A. End of life and palliative surgery. Deciding whether to proceed with surgery for terminally ill patients involves balancing the potential benefits against the risks and burdens of the procedure. Surgeons must engage in honest discussions about the goals of care and the likely outcomes. B. Experimental and innovative procedures. The use of novel surgical techniques or experimental interventions raises ethical questions about safety, efficacy, and patient consent. Surgeons must adhere to research ethics and ensure that patients understand the experimental nature of the procedure. C. Conflicts of interest. Financial incentives, such as those related to device use or hospital quotas, must not influence surgical decisions. Transparency about potential conflicts is essential to maintain trust. D. Global inequities in surgical care. In low-resource settings, surgeons may face ethical dilemmas about prioritizing care for certain patients due to limited resources. Efforts to address these inequities through advocacy and collaboration are part of ethical surgical practice. 4. Professionalism and surgeon-patient relationship. A. Communication. Effective communication fosters trust and helps patients make informed decisions. Surgeons must provide clear, honest, and compassionate explanations. B. Confidentiality. Protecting patient privacy is essential, including sensitive information related to their condition or procedure. C. Competence. Surgeons have an ethical duty to maintain and update their skills through continuing education and training. Acknowledging personal limitations and seeking consultation or referral when necessary is critical to ethical practice. 5. Ethical issues in surgical research. Surgical innovation often relies on clinical research, which must adhere to ethical standards, such as obtaining informed consent from participants, ensuring the research is scientifically valid and has potential social or medical value. minimizing risks and ensuring an appropriate risk-benefit ratio. 6. Ethical dilemmas in modern surgical practice. A. Robotic and AI-assisted surgery. Ethical considerations include patient consent for the use of novel technologies and ensuring equitable access. B. Cosmetic and elective surgeries. Surgeons must ensure that such procedures are performed for legitimate reasons and not driven by societal pressures or unrealistic patient expectations. C. Refusal of surgery. Patients may refuse recommended surgery, and surgeons must respect this decision while ensuring the patient understands the potential consequences. Addressing ethical breaches. Institutions should have mechanisms to address ethical violations, including peer reviews, ethics committees, and patient grievance redressal systems. Surgeons must report unethical practices and advocate for patient safety and justice. 8. Promoting ethical culture in surgery. Regular ethics training and discussions for surgical teams. Institutional policies that prioritize patient-centered care and ethical decision-making. Fostering interdisciplinary collaboration to address complex ethical issues. Ethics in surgical practice is not static. It evolves with advancements in technology, changes in societal values, and the growing complexity of healthcare systems. Surgeons must remain vigilant, adaptable, and committed to upholding the highest ethical standards in their practice.